Hi, and welcome to Dr. Diego and Debbie. I'm here at the Allende Center for Regenerative Medicine and Vitality, and this is Dr. Allende.
Hi, Deb.
Hi.
How are you doing?
Doing great.
Good.
Today, I want to discuss a topic so many people have been asking me about. It's like fingernails on a chalkboard to me when they say, ask him how we can lose weight. What do you say?
Our lack of sleep is a physiologic stressor and an emotional stressor. Hard to focus, hard to understand what is trying to be conveyed to you because you're exhausted. Okay, and on top of it, your body's releasing cortisol because it's stressed out because you didn't get enough rest. So now you're making sugar hormone available, which makes you have cravings for sugar too, by the way. So you're stressed, so that's what people tell you when they say, oh, stress eating. Because when you're stressed, you have this hormones release, cortisol release your brain. It's releasing hormones that make you want to crave sugar products. Okay, but it also creates cravings of some salt sometimes too. So you alternate, because remember, it's making mineralocorticoid be released too, which is your salt-retaining hormone. So you have cravings in between either one or just one. You know, like people have IBS, IBS, irritable bowel syndrome. Usually what do you have? Diarrhea or you have constipation. Some people have both. So this is likens to that, basically. So you go through these cycles of having these physiologic responses. So the cooler head always prevails. The cooler head will always take you in the right direction for weight loss. Getting enough sleep, eating the right nutrition, portion control, a mild to moderate exercise routine to maintain, if not make a little muscle mass. And that's how you're going to get there. And if we give you supplements that help do that, good. If we can give you and reduce some of the toxins in your body that take away from the positive response, like the caffeine and alcohol, you're going to get a better response. And if I can give you a medication that maybe we use as a crutch for a little bit to help you get going, as we change your patterns that you go through life, that your normal routines, then we're getting you there. We're getting you there, and I think everybody's going to see a positive response. And then I have people tell me, doctor, I don't eat numbers anyway. I go, okay, do you have a diary? So yeah, but it's like a cereal and it's a salad. And that's it. I mean, I don't take 1,000 calories and I can't lose weight. And they weigh 260 pounds, something like that. And it's like, okay, so there's a lot going on there. There's sleep issues, there's dietary issues, there's lack of exercise. And I can't exercise because I'm exhausted. Okay, well, that tells me a little bit too. Yeah, so you really got to eat food, though. You got to eat food, right? Yeah. So they got to eat food, but they got to eat the right types of foods. And then you got to get an exercise routine, like we said. And they got to get a lot of hydration because, for as much as these have to be reiterated on a daily basis. It's like your chalkboard at home, And it says, boom, boom, boom. And you walk up and you see it every day. This is my task. I got to do these things. And that's the best way to do it. You have your chalkboard reminder of all the things you need to do to reach your goal. And if you practice that every day, whatever mantra it's in your life, you're going to achieve the goal because you're living it, you're working it, right? You're gonna make it happen because you know what you need to do, and it's written in front of you every day, so you get to look at it. And I think that's the best way to do it because that's like having a life coach at your house every day.
My mom had an episode, I'll call it. One time she was diabetic. She decided not to eat for many hours. And basically almost went into a diabetic coma.
Yeah, and that's not understanding, right? Not understanding. Right. And that's where they tell you a little bit of knowledge goes a long way in going to bad direction. Because they think, well, if I'm a diabetic, then I'm not going to eat. And that's going to make my sugars. Then they don't understand the stress response and what your body does. But the problem is you still don't have insulin, or your insulin doesn't work right, so you can't really absorb the sugar anyway. So then you have vast amounts of sugar in your blood from the breakdown of fats. Oh, and by the way, fats break down to ketones, and they go through beta oxidation, so you become acidotic. And if you're acidotic, that's going to get you into the hospital pretty quick. You get diabetic ketoacidosis. So that's the danger we run into, not understanding enough about the disease process. Like you said, if she would age, she probably wouldn't have had that elevation.
Right.
It's the choice of foods.
Absolutely. I grew up during a time when, they were pushing diet pills and, diet sodas constantly. I remember my parents telling me about a girl that had died from, she wanted to get really thin, so all she did was drink diet soda, and To me, that's just poison.
It is poison.
Yeah, and this was many years ago, before things like stevia, you
Yeah.
know.
Natural sweeteners, but the aspartame and things like that they use for that. That's on the verge of being outlawed by the FDA every year because it has so many side effects. If you actually look up aspartame on on a Google search and do some literature search, go to the PubMed website and just punch up, you can see the adverse reactions and side effects people have from aspartame. So I encourage people to definitely not use those type of sweeteners. You can use a natural plant sweetener, like you said, like a stevia. That is a better a product to use. Because it has chloride in it, okay, and it displaces your iodine molecule in your cells.
My God.
And all of our cells in our body are sensitive to thyroid hormone. And so if you're displacing iodine, because chloride molecule is a little more unstable because it only requires one more electron to make it stable. So it pushes iodine because it's more stable, has less electron molecules on it, so it needs to be stable, so it gets pushed out. And then suddenly you can't make thyroid hormone. Okay, so your hormone becomes less functional because you're unable to produce it in an effective way. Again, I can test these things because I read them and I know them. But just having people have access to that information is difficult sometimes because most of the time, they go to the physicians for consultation, but most physicians really don't understand anything about nutrition. They just tell you eat less, like you said, but there's no plan. Just eat
Right.
less. Eat less. What does that even mean?
Yeah.
If you don't have.
They don't even know what you're eating now.
Right.
And they're, we'll eat less. Okay, I'll
Yeah.
eat nothing, and then, yeah.
Right. So understand, having information, more information you have, the better. But putting that into a moderate, approach is super important. Because if you do that, you're more likely to have a better outcome. And not all the same treatment. And not all the same treatments work for everybody. Like you said, you've got to be willing to try different things and not give up. You stick to the plan. Live the mantra every day. And I think you write it on the wall and you look at it every day like a little board and you go, okay, that's what I'm trying to do every day, just like any goals you have in life, right? And if you do those things, you learn how to approach it, how to achieve it, and how to basically bounce back, right? Because like if you fail, like, oh, I didn't follow it that day. That's why I didn't make any progress. And so you go back to it and you kind of live it every day. You get the responses you're looking for.
That leads me into the next topic that I've been reading a lot about this lately. A lot of advertisements. They want you to take a little test and they're going to tell you what vitamins or supplements you need. Now, what's good or bad about that?
Okay, so those tests, okay, those are usually based on the moment in time, right?
Mm-hmm.
So remember, those most of our vitamins are water soluble, which depends on hydration, and it depends on what you ate that day. Okay, so usually, and some cells will retain some more vitamins and minerals longer, but for the most part, we get depleted rather quickly because they're water soluble. It's the fat soluble vitamins that are more easily able to assess, and there's only 4 of them. It's like A, D, E, and K. Well, those levels are not going to change very much when you fast them, because they're fat soluble, so they go into your fat and they kind of store there, and they kind of release slowly in time into your blood. But the water soluble ones are going to change, so are the minerals. And so I don't think that the tests are necessarily a bad test. I think to rely on them completely is not a good thing. I think that if you don't take, first of all, if you're taking a lot of diuretics, right, you're going to be urinating out most of your supplements and most of your vitamins and minerals. And so it's not going to be an accurate test depending when you take it in the day.
Oh.
Right, so if I take it in the morning, I'm probably going to be less dehydrated and less, well, maybe not dehydrated, but I'm going to have more of my minerals and my vitamins because I haven't done anything overnight. But if I take it in the afternoon, say after I had all my coffee and I've exercised and a bunch of other things that I've done and been busy all day, probably not going to show up as clean as it normally would be. So a vitamin assessment is going to be most accurate probably first thing in the morning, like your first urination.
Okay.
That's when you get some of those minerals and vitamins into your urine, and then you have a normalized ratio that we create when we do these tests, and we're able to look and see what you're deficient in. But they're not a bad thing, they're a good thing. It's the timing of when you do it. And I think that's the most
Interesting.
important thing. I think that's a great starting place. And I think that if somebody starts to take a supplement and they notice an improvement in some aspect of their life or focus or memory, then I think that maybe you're going in the right direction. Obviously, it's super important to be followed when you do nutrition because although most water-soluble nutrients and vitamins are not toxic for you, people can overuse them and they become toxic. For instance, most people are a little selenium deficient, most people are a little bit iodine deficient because our food is stripped of these things because the grains got them taken out decades ago because we used to give people too much selenium and too much iodine in certain parts of the country where the grain was high or the soil was very high in these minerals.
Mm-hmm.
And so they have problems with being over saturated with these minerals, which causes some problems. Like iodine was so high they would get these large goiters in their neck.
Wow.
Yeah, and so in the Ohio River Valley area and things like that in the Midwest. So they took it all out and they replaced all the grain with bromide. So they gave you a neon or a chemical agent which is not native to our body, which is toxin because we don't need bromide for anything. And what they needed to do is just probably control how much iodine we were getting in our diet, and same thing with selenium. So, I think that there is toxicity associated with some of them. You can't take too much stuff. You can't take too much vitamin D. There are some safe parameters. It's good to have a nutritionist involved if your physician or a clinician is not well versed in nutrient replacement or what's a toxic level or even understanding what it means or what the side effects can be from getting too much. I think that unless you're a nutritionist or you've got some board certification in nutritional management, like I have my master's in metabolic and cellular nutrition, so I understand, but I also understand that having a little bit of information goes a long way in a bad direction sometimes. So it's good to be supervised. It doesn't matter how super smart you are too. That's why doctors aren't their own doctors. That's why doctors aren't their own nutritionists. It's like we like to get an idea. Usually we have, consultant physician, nutritionists help us with our own stuff too because we can make mistakes too.
Let's say that I was a new patient and I came in and I wanted to be put on a program for, and I hate the term weight loss, but just a good nutritional program. Mm-hmm. Are there some supplements that you would recommend? Or what would be the first thing you would do? Would you send me out for blood labs?
So the answer is yes, but the answer is no. So the answer is yes, is we should. Okay, we should. Let's check for some labs and check and see what you're maybe deficient in. Remember, there's a moment in time, so it's the time is critical. But the other issue is whether cost analysis. So is it going to cost a lot of money to do the testing? And now they're making it more affordable, but the quality of the test is questionable sometimes. But should everybody be on a price supplement? Absolutely. On a generalized basis, everybody should take a multivitamin. So that way you get your guaranteed necessity of minerals and your vitamins that you should get on a daily basis. And understand that most supplements and vitamins say that, on the back they say this is the 50% recommended daily allowance. And what it should say is recommended daily allowance to not get disease. That doesn't mean that you're optimized health. So if my recommended daily allowance is like 50 milligrams, that's minimal to not get disease. But where am I optimized? Where is the best cellular function going to occur? So that may be like 500 milligrams. So so we should at least take a minimum multivitamin daily. Everybody should take a multivitamin daily. Everybody should take a B complex vitamin in the afternoon, because if most of us drink coffee or drink a little energy drink every once in a while, or just drink mostly caffeine, because most of us are not drinking booze during the day.
Most of us.
Yeah. So you should take a B complex because they're water soluble. So usually your body's used them up and excreted them probably within about 6 to 8 hours, maybe 12 hours, depending if you don't drink very many diuretic foods like caffeine. But otherwise, you should so you should take something in the morning, take something in the afternoon. You should split them up to get the adequate amount. Then you're optimizing your health. And then, and that's a minimum, a B complex and a multivitamin that's got all your minerals and vitamins in it. And then, depending on the rest, what your goals are, right? So, if I'm trying to replenish my, for instance, like antioxidant levels in my body, right? So I'm taking N-acetylcysteine so I can make glutathione, right? We talked about this before. And I'm taking that because I want my blood a little thinned, because I know it's healthy, number one. Okay, a little thinned, okay?
Right.
It's
You
emphasis
don't want
on
to
little
bleed out
thin.
if you get
Right.
a cut. Yeah.
So, and it's healthy for that, and the studies have shown that it's very healthy for that. But also, when it helps replenish glutathione stores, glutathione is really important to help stabilize you, get oxygen-free radical damage to your arteries, which causes plaque formation and hypercoagulability. Okay, so, and it also improves the quality of your skin. Okay, so,
Good for that.
so super important that I think that, that I'm going to take that, and if patients want to take it, I'm going to emphasize this is a really important quality product you should take, especially if you're trying to avoid certain oxidative effects that happen over time for too much metabolism, sun damage and things like that too, or infections like COVID-19, right? That kind of stuff too, because it turns out most people are a little bit glutathione deficient, so we want to replenish those things. So I think we do that. They usually add that in, and if they want to add other things, depends what we're looking for. Like I usually give a minimum regimen, like of certain items that I like to give, multivitamin, I give the B complex in the afternoon. Depends how active my client or my patient is. If they're very active and they're exercising on a regular basis and they're real picky about their foods, I'm saying, okay, why don't you take 50 milligrams of zinc, because because most people deplete their minerals when they sweat or are active, whatever activity that's going to be. So you want to replace zinc, and most people are magnesium deficient because they're urinating it out all day, and that may be contributing to membrane stabilization, which improves your heart rhythm and your relaxation of your arteries and capillary beds. So I usually put people on some magnesium also, because most people are about 500 milligrams deficient of magnesium on a daily basis.
Interesting.
So you should be taking these things, especially if you have problems with constipation, okay? Because magnesium is cathartic too, so it helps you go to the bathroom. And so if it does that, and membrane stabilizes your arteries and capillary beds, it also improves the function of your heart, probably should be taking magnesium, especially if you drink any of those fluids like caffeine or alcohols, which deplete you of those things. So I can make an argument for a lot of those supplements that I give my patients, and it just depends on their activity level too, and again what they're able to afford. Like if I have a rheumatoid arthritis patient, okay? Rheumatoid arthritis patient, so they get a lot of inflammation. So I want to decrease inflammation. So yeah, I'm working with a rheumatologist, and they're saying, oh, well they need to be on these disease-modifying anti-rheumatologic disease drugs. Okay, so they're going to pick them from their gambit of drugs that they have to help suppress that response. Now, from a standpoint of what I'm trying to do, I'm trying to decrease inflammation from a holistic or naturopathic way, right? Mm-hmm. And so I want to give them things to help provide lubrication and decrease inflammation. So I'm going to give turmeric, because the curcumin is the active component in that product, and so the highest percentage available is going to help decrease inflammation. It's an anti-cancer drug or anti-tumor drug, so it's very good, a supplement to take. I'm going to put them on fish oil, because fish oil is a lubricant for joints. It also decreases inflammation, and most of us are we have such a low level of the active omega-3 fatty acids in our bodies that we would all benefit from it. So I'm going to put them on that as a minimum, and then I'm going to put them on some ginger extract too, because ginger is a natural anti-inflammatory, very strong too. And so I'm looking at that, depending on what you're presenting with me, right? So I may modify and add things in depending on what you have a condition, or some condition you may have or not. Mm-hmm. Sometimes people come in and they have little memory issues, okay? And they want to be on a supplement that helps decrease the signs of aging, at least, mentally, and they want to decrease the likelihood of developing dementia over time, or improve their quality of memory, or their memory overall. So in that case, I may have a patient, and I put them on a bunch of supplements, and I go, hey, let's add this product in there, and that product may have things that help improve blood supply to the brain. It also helps decrease breakdown of an enzyme called acetylcholinesterase, which is an enzyme that breaks down acetylcholine. Now, acetylcholine is really critical to neurons making connections with other neurons through dendritic connections that helps preserve memory and create new memory. So if I can decrease that enzyme from breaking down the enzyme that helps break down those over time, then I'm going to have a better memory, a better retention, maybe help create new memory connections. So I'm going to give them a product, and so I usually give patients a supplement that's got a combination of increasing blood supply, decrease that breakdown. So I use a combination of something called vinpocetine, huperazine A, and ginkgo biloba. And so these things work really good. You get them as a natural supplement, and so we can get them like from a proprietary company that has their own marketing on it. But so we don't need to put that name out here right now. But the whole point is that different presentation, a different goal, different supplement.
Okay, so it's not a one-size-fits-all.
Nah, there's no magic bullet because I just want everything fixed. Well, everybody walks in the office and says that.
Yeah, we just want to come in here and
Yeah, but
give me a shot.
I can't do that. I can't just go bink. So, it takes time. It takes an assessment. It takes probably listening to your patient, more importantly, what they're trying to do, what the goal is, and what maybe the family's concerns are, because the family's there too. They're here because they're concerned. They want to do this, make this decision together. So a lot goes into it. It's not like here you go and it's slam bam, thank you ma'am, kind of. It just doesn't work that way. It's at least that's not the correct way, or the best way. The best way is to take your time and go through the assessment and use some tools to get to that assessment, and then cherry pick what we're going to do, and let's monitor, see what the results are, and then sit down and talk about it again in 3-4 months.
I'm down for that.
All right.
Definitely. All right, well, thank you. This has been very interesting.
That's my pleasure. I always
And
enjoy it.
I know that a lot of friends and people in the audience will appreciate this information.
Well, thank you for having me. I always appreciate it.
All right, great, thanks.
Thank you.